Hi everybody. Which school are you from? Wow. Okay. Many schools are here. So today I'll explain. Dr. Anita ma'am explained about CPR, gada. Now I'll be explaining about certain instances like hypothermia, how to handle a case with hypothermia, or how to handle a case with poisoning. So these are something which we see in our day-to-day life. Once in a while we do see. So now I'll be talking about, my name is Jayesh Ashank. We are from Osmania Medical College, and today we'll be talking about hypothermia, heat stroke, insecticide poisoning. Farmers and all, they'll drink poison, no? How to handle that. And we'll also be talking about electric shock. Okay, these four I'll be dealing with this today. What is hypothermia? Hypothermia ante telsa? Hypothermia means your body temperature 37 degrees. There's a constant temperature which a human being should maintain, 37 degrees. If it reduces below that temperature, it is called as hypothermia. Hypo means less, thermia means temperature. So when your body gets cold, when does your body get cold? Very good. In winters or in very heavy rainfall, if you don't wear any sweaters or protective clothes, and if you stay outside, you'll get that cold and you'll become unconscious. It is most commonly seen in security guards, policemen, watchmen. If they don't wear those sweaters or something and they have to work outside, night duties and all, in that cold weather, they'll get that cold and they'll become unconscious. Tomorrow morning, you're going to college or school. If you see a security guard on the ground, what would you do? You leave him like that? No. We have to do something, no? So this is what we are going to tell you. As basic humans or common men, what we can do. First thing, for everything, you should remember a mnemonic. Dr. ABC. DRABC. 5. Repeat after me. ABC. Very good. D stands for danger, which means not everybody will genuinely lie down or will get that issue. Some will be like thieves. Okay? They'll trick you. That is why they'll fall off. You'll feel something happened to them and you'll try to help them. Maybe they'll take out some knife and they'll do something to you. So first you need to look for any danger if he's there, if he's genuinely ill, or maybe if he's acting. So danger is first thing. You should ensure safety. Second is R, stands for response. As ma'am said, you should check if the boy or if the victim over here is responding or no. How will you check that? Ma'am explained. Very good. That guy is doing over there. You have to pat on his shoulders. Hello, are you okay? If he's responding, well and good. If no, immediately start CPR. CPR నేర్చుకున్నాం కదా, full form of CPR? Very good. Okay. So cardiopulmonary resuscitation. So D for danger, R for response. If he is responding or no. A for airway. Airway means this is called windpipe. You take in, no, that is known as windpipe or airway, air passage. You have to check that air passage. If he has something in his air passage, any food or any some materials inside, look at it and remove it. Maybe that's obstructing his airflow. B for breathing. As ma'am also said, you have to check if he is breathing or no. C for circulation. Pulse. Ma'am said, right? Pulse. If any of these are missing, immediately start CPR. Now, when he comes back to consciousness, first thing you need to do is remove the victim from where he is. Now, he fell down on the road. It's a cold night. He fell down over there. Remove him. Place him somewhere, little warm area. First, remove the victim and place it in a warm area. Next, you need to remove all the cold clothes which he was wearing. Maybe it's a rainy night. All his clothes got wet. It's really more cold, right? So first remove all those clothes as much as possible. And look for any dry cloths around you. Maybe a chunni or any cloth, any dry cloth. Immediately take it and place it over the victim's body. What will this do? Why are we putting blanket? Ratri padkunnappudu, while sleeping, you guys wear blankets, right? Why? Warm. We are giving warmth to him. So take a blanket or a bed sheet, place it over him. If possible, fold it. You need to fold it and place it over him. Why should we fold it? We can simply place it over there now. Very good. Physics. Very good. Okay. We need more warmth. That is why we'll fold it and we'll place it on him. Next, what should we do? We should, cinemallo chusuntam. We've seen in the movies. We'll rub hands, palms, soles of that victim. Why do we do that? Why do we do that? Heat will generate. So whenever you're doing that, you'll get more heat. That we have to do. And if the patient is conscious in the sense, if the patient is responding, give some lukewarm water. Lukewarm in the sense, do you guys know what lukewarm water is? Little warm water, not very hot water. Why not? Yeah. Very good. Yes. Very hot water, if he ingests it, you guys will think more heat will produce, but no, it will damage his airway. Okay, so no, lukewarm water should be given. This is basic things about hypothermia. First thing, Dr. ABC. Second thing, remove the patient where he's from. Take him to a warmer place. Third thing, remove all the cold clothes he has. Fourth thing, whatever you see, any dry blanket or something, immediately take it and place it over him. Rub his palms and soles and give lukewarm water if he is able to drink. If he's not conscious, you should not pour warm water into his mouth. Why? No, there is risk of aspiration. Aspiration means whatever you drink, it should get inside your food pipe, not your windpipe. And that will happen only if you swallow by your own. If the patient is unconscious and if you put water inside his mouth, there is a risk where the water gets inside his windpipe. That means you're worsening the condition. You're not bettering it. So do not give water if he's unconscious. Main thing. And you should not even give alcohol. Mandu iste vedi pudutadi ani antaru. No. Yes, that's true that heat will produce if you drink beer or alcohol. But that heat produced is very fast. So heat loss will be more faster if you drink alcohol. We should conserve heat and it should come as slow as possible. If you give that alcohol, heat will produce really fast and it will go off really fast. So no alcohol. Okay? Next, we'll talk about heat stroke. Hypothermia ante it's cold temperature, cold. Heat stroke ante opposite. Yes. Telugulo దాన్ని ఏమంటాం వడదెబ్బ అంటాం. Heat stroke, right? So who will have this heat stroke? More risk everkundi? Old people, very good. Old people and the ones who work under sun for long hours. Daily wage workers, farmers also work very hard for us, no? They can also have heat stroke. So if you see a farmer or your grandfather working in the field, suddenly he collapses under the sun, you should do something, right? You can watch it like that. So what you can do now? Similar, again, Dr. ABC. Some people might fake it. So be careful. Your safety is important first. So Dr. ABC, D stands for danger, where you look for safety. R stands for response. Check if he is responding or no. Pat on his shoulders, hit him. If he's saying yeah, maybe he's conscious. No, he's not conscious. A, B, C, airway, breathing, pulse, circulation. If nothing is there, immediately start CPR. And then if he gets back to consciousness, what's the first thing you should do? In hypothermia, we remove the patient from the cold place to a warmer place. In heat stroke, yes, very good. From a warmer, that sun on that field, remove him from there. Take him to a shady area. First thing, very good. Second thing, in hypothermia, we removed all the clothes. Here, no, you'll not put all the clothes. Here, you should make him comfortable. Maybe he's wearing a lot of clothes. Make him comfortable. Remove at the collar button or something. Make him more comfortable. Okay? Okay. So you should remove all the buttons and all. Make him comfortable as possible. So that koncham air aina vastadi annamata. Okay? Third, If he is conscious, give fluids. Matlab water. What happens in heat stroke? In heat, what will happen is all that water inside your body gets dehydrated. Water gets out. So if he's conscious, give nice amount of water. ORS, you guys know what is ORS? What's the full form of ORS? Solution. Very good. Oral rehydration solution. That you need to give. And simultaneously, when you're doing all this, immediately you need to call for help. You alone can't do this. First aid means before the hospital people come, what you can do. So doing this only, you should simultaneously call for help. Call what? 911. Very good. Call 108 or anybody surrounding you. Point them. Tell them to call for hospital. Until they come, you do something. That is called first aid. Okay, don't forget to call for help. Okay, where were we? ORS. Very good. And one more thing is, if you don't have ORS at home, what you should do? No. Wow, very good. You're giving all wrong answers. You should not give ice, cold water, nothing. That will not do any better. Very good. Who's that? Claps. Amazing. Very good. That is called homemade ORS. Homemade ORS is made up of salt and sugar and half lemon. 6 teaspoons of sugar, 1 teaspoon of salt and half lemon. In what? In 1 liter of water. Very good. Alright, so we will give that ORS. Okay, this is all we can do. Next we'll be talking about one more thing. You guys said stick or plastic scale, anything. What if it is in contact with water? Let's say I have a wet stick. Can I use that? Why can't I use that? It's a wooden stick. Yes, you should not use anything which is in contact with water. It should be a dry stick, dry plastic scale. Use it and separate. Now follow Dr. ABC. Danger, response, airway, breathing, circulation. If nothing is there, immediately start CPR. He'll come into consciousness. Let's say he comes into consciousness. Then what you should do? Electric shock valla em avvachu. You can have burns. My hand, it might get burnt. Or what else? My heart can stop functioning. I can have a cardiac arrest. Or I can have severe burns. In that condition, how to treat? First of all, burnt area, you should cover it with a clean, sterile cloth. Sterile means germs. Don't use genuine, normal, these cloths. Clean, sterile cloths needs to be used. We should not use cotton cloths or something. Why can't we use that? If we use cotton cloths or, fluffy cloths, cotton cloths and all have fibers, if you know. That will stick onto that affected area. It will worsen the wound. So we should not use such kind of cloths. Okay? And then lastly, we are going to talk about insecticide poisoning. Insecticides, do you guys know what insecticides are? What are they? Where are they used? Very good. So who will have more risk of this insecticides poison? Very good. So for such people, and very common in rural areas, if you see any farmer having white color thing coming out of his mouth, that means he has drunk some poison. How do you combat it? You can't leave him like that. So first thing which you need to do is remove that poison bottle away. Throw it away. It is because if he gets into consciousness, he might take it again. Because why do people take poison? They won't take it by mistake. They take it purposely, right? Yes, suicidal attempts or something. So you need to throw the bottle away first. And then you need to remove his clothes. Why should I remove clothes in a poisoning case? It may? Okay, that's true. And why should I remove that then if it's on his clothes? It's not getting inside the body, right? Ah, very good. Smart people. Skin has pores. It has that capacity to seep into the skin, into the body again. So we need to remove the clothes which are contaminated with this poison immediately. Second of all, you need to wash the skin with soap and water so that any traces are there, they'll get washed away. And what are the signs and symptoms? What if he lies down and you don't know it's poisoning or no? First, you need to look at his eyes. Eye slow will have pupil. Does anybody know what a pupil is? Basically a small circle over here, if you observe. If that pupil is like needle like, it is very constricted, it is a very big sign of poisoning. Second is nuraga ravadam, emesis, white color foamy thing comes out of his mouth, that thing. Excess sweating, if you sweat a lot also it will happen. So these are the signs which you should notice, okay, and immediately start the protocol. You need to wash it over here and all. And if the victim is conscious, what you will do is request him, ask him, he should induce vomiting. You know how to induce vomiting? Manaka manam vomiting చేసుకోవాలి. ఎట్లా చేసుకుంటాం? Very good. We need to take 2 fingers. We should keep it inside. Just like my tongue over here, there's a small tongue up. Do you guys know there's a small tongue that is known as uvula? You have to touch that uvula. Whenever there's contact to that uvula, no, vomiting comes out. So only if the victim is conscious, then only we should ask him to induce vomiting. Let's say he's not conscious, he's not responding. You will keep your hands into the victim's mouth and induce vomiting. Is it a good option? Why not? Anything which he ingested, it's coming out, right? It's good for us. I told you this before. If you listen, yes, very good, very good. Clap for him. It might get into our windpipe. If the patient is not conscious, windpipe and foot pipe, they can overlap. So we should not induce vomiting if he's not conscious. Okay. Now, insecticides are not acids or alkali. There are certain compounds. What if he ingested acid? Acid tagesadu and he's conscious. Will we ask him to induce vomiting? Obviously, the answer will be no, because I'm asking now. Why is it no? No. No. See, already that acid is corrosive. Matlab, when it falls on skin, your skin will burn, it'll slit open. Now that acid he ingested inside. Again, you're asking him to let it out. Going in, coming out, it will damage your esophagus, your stomach, your intestine, everything. So we should not ask him to induce vomiting if he takes any acids or something. Immediately we should go call for help. That's all we can do. Okay, if he takes any insecticide poisoning or something, then okay, we can induce vomiting. Understood? We are trying so hard so that you guys should know these basic stuff. You should not leave any common men out there who are suffering over there, leave it like them and take videos or photos. You guys should be the first men just like us. Common. This is the first aid thing which you need to know. So please pay attention. Next up we have Dr. Vinutna taking over, and she'll tell more about instances.
To stay informed about the startup ecosystem, subscribe to MyStartupTV.